Up to now, there is no sufficient evidence about cross-border healthcare fraud in Germany, neither in the EU. So we have to talk about what is going on. We have to have a common interpretation of EU law, but also a common definition what is healthcare fraud in cross-border healthcare. Therefore, this conference is very important and very fruitful because we can exchange and discuss recommendations of other countries, how they tackle with this field of problem.
The focus that Greco has had, and I think that's the best practice I would like to recommend, is to focus on prevention, to set up a net that prevents corruption and fraud before it actually starts. And for that to happen, what we need is adopt a series of preventive measures that both the public and the private sector should follow. This includes the development of a code of ethics, code of conduct, with an enforcement mechanism attached to it. It includes rules about management of conflict of interest. It includes rules about lobbying, questions that relate to incompatibilities and revolving doors. These are all preventive tools that, if properly implemented both at the public and private level, will help us together fight corruption and fraud in the healthcare sector, but in any other sector as well.
So one area that is sometimes overlooked when we discuss fraud and corruption in healthcare is the health policy-making process. So at the OECD, we're working to increase transparency and integrity in the health policy-making process by looking at, for example, the management of conflict of interest in the healthcare system, but also of the way of regulating or providing transparency and integrity to lobbying in healthcare systems and the way that different stakeholders influence the policy-making of health policies.
I could answer in a very brief and short way and say, you can implement the new guidelines of the International Social Security Association, but then I would get the next question, how to do that? And you can do it really by reading it, realizing that it is the tool for fighting fraud, error and evasion, and that it offers you a huge toolbox how to do the implementation. And these are world-class guidelines developed by the experience from around the globe. And if you're not sufficient with that, there are also diplomas, trainings, a kind of certifications for that. But whenever you think about that, you have done the first and most important step. You have to fight fraud, error and evasion, because otherwise it's impacting your integrity of your organization.
I think international cooperation would be important in a number of ways. First of all, of course, we can learn from each other's experiences by exchanging best practices, for example. We can help each other by identifying trends or perhaps cases that could be interesting from one country or another. And perhaps even the most important things would be just the networking. What I find very strong about EHFCN is that it's not only members being regulators or supervisory authorities, there are also other types of networks. And I think in our world that changes rapidly and that is organizing also more in a network way, then we should work more as networks as well. So knowing the people, knowing should any case come up, then if you know better who to contact in whichever country, I think that would help us a great deal as well. So apart from all the very interesting content that we exchange, just getting to know the people and getting to know each other a little bit better would be extremely important for all of us.
And so what we're doing with EHFCN is currently working out on a Benelux plan of action with which we would care more for, on one side, the dissemination of information for the patients themselves as to know better what their rights and obligations are, but on the other side as well to look for a matrix which would better define what the various classifications of fraud could be, so as to allow the authorities to better handle them.
I think the lessons we've learned from this conference are that people are enthusiastic. They want to learn and understand data. They want to get the most they can out of it to actually tackle healthcare fraud and corruption and also waste. But there's some concern here as well, because who has access to this data? How are they going to use it? Is it secure? There are obviously privacy issues here as well. But overall, I would say that there's a great enthusiasm, we're moving forward, and we want to learn from one another within the healthcare sector and beyond on to come up with the best way that we can prevent and reduce fraud and corruption in the healthcare sector.
Digitalization increases also the opportunities for more fraudulent behavior, especially the systematic components of fraudulent behavior. Examples are invoice apps or internet platforms, which make it easier for providers and members for certain fraudulent behavior or to increase the delivery of care. For this reason, we have to work together nationally and internationally. Cooperations are needed to better understand this kind of fraud and behavior. And we also have to come up with new forms of prevention and also of detecting fraudulent behavior.
Well, I think the most important thing about data analytics and machine learning is they're a good predictor. So not only can you use them to better understand the potential of overprescribing and misuse, they're also an accelerator for analysts. So if you're able to take a large population and learn from that population what might be a predictor of overprescribing or what providers might be overprescribing, the amount levels, you can reduce the workload for analysts. So it's not a silver bullet by any means. I look at it as a toolkit.
We have regularly done assessments of the fraud loss measurement exercises that have been conducted on fraud in healthcare in the European Union. And in the most recent study, which is based upon 137 exercises, it's 6.49%. If that was applied to expenditure on healthcare in the European Union, that would amount to 96 billion euros. So the cost of fraud in healthcare in the European Union is very, very large. That is a massive sum of money.
And the thing about cybercrime is it's very, very rapidly evolving. The best way to think about it is like a clinical virus, continually mutating and changing. When you talk to people who do penetration testing, or sometimes called ethical hacking, testing the defences of organisations against cybercrime, they say that if they stop doing what they do for more than 6 months, they can never catch up with the evolution of the problem. So it evolves that quickly. So defining cybercrime is actually quite dangerous because it continually changes.
We need to provide legal protection with whistleblowers. Then still more people would probably have the courage to report irregularities in the healthcare system.
The conference tackles for me a crucial problem: the fast-changing environment and the fast-changing societies, and how to deal with it. The main challenge about digitalization is how to handle with all the data who are faster available and much on a larger scale.
Yes, this was a very successful conference, the national conference of the EHFCN this year in Berlin. It was extremely well organized, and with that opportunity I would like to thank the local organizers for their efforts. And the plenary sessions were very, very interesting, and I think that everybody really enjoyed those. On the other hand, the parallel sessions with topics ranging from health policies across the EU to data mining and machine learning and artificial intelligence techniques, all the way up to smart apps and IoT devices, gave anyone food for thought.
EHFCN indeed is working hard in the project promoting integrity in the healthcare sector. And it is for us an opportunity also to involve the stakeholders in the field, because we think that we cannot solve this by ourselves, we cannot do it alone, and it would be really the good moment to sit together with everyone and have all our chain partners and everybody involved in the healthcare system. To do that, for the next year, in 2020, we will be celebrating the 15th anniversary of the network. And we are very proud of this, of course. And it will be an occasion, an opportunity for us to reach out, to raise awareness, and to effectively try to manage and promote integrity in the healthcare sector. We will have a special focus on conflicts of interest, because we think that this is also a positive way to present the subject. And we would very much like to go forward with this study in partnership with other important players in the field, be it OECD, be it the European Commission. And we will reflect on all these issues next year at our national international conference, which will be hosted at the premises of the Council of Europe in Strasbourg.